unexpected class 2 scenario, just like I mentioned before. So this patient came in, and believe it or not, it was just a removal of an existing amalgam, and that's the darkness that you can see down here. And when I got in there, there was a small fracture line on the mesial marginal ridge, but it didn't look too damning. And radiographically, it was clear. And then when I got in here, it turned into this, and you can actually still see that the fracture went even further. And so these types of situations, they can really disrupt your schedule, right? Like you're planning on doing one thing, and now all of a sudden, it's kind of exponentially harder. And it's nice to have a go-to tool to kind of bail you out of these situations. And so this is the BurtonBands posterior placed in that situation. And so you can see the wedge handle, and you can see the splitting wings on the palatal side here. So most of the time I'll insert it from the buccal direction, but it doesn't have to be that. This thing's extremely versatile, and I'll drive that point home a few different times tonight. It's like you can use it however you want, and I'll show you a few different ways to. So you can insert it palatally or facially, it doesn't matter. But you can see the wings split here, and that's the papilla right in the middle. So that wedge being able to split allows the matrix band, which is attached to that portion, to kind of follow the tooth all the way around. And then you've created this little home for your restoration. And in this case, all we do is restore. So in cases like this, where you don't have a super wide prep, you don't necessarily have to use a ring. You can if you want to, and I'll show you how to do that later as well. But in these cases where you have, a pretty tight wedge here going in, you can just burnish this matrix band and be done. And so that's what we did in this case. That's immediately after, and that is the final restoration. And I took a radiograph immediately after just to kind of see how effective this was in these, because that restoration went subgingival, as you could see there on the previous slide. And this was before I did any occlusal contouring on this, but you can see how nicely it sealed the gingival margin up in this area. And again, it's just a nice bailout tool. It's not for every single situation, not for back-to-backs, not for a ton of quadrant stuff, but when you find yourself in these situations, it can do a good job for you and help you get through that situation relatively quickly.